Hi, I am student nurse Emily. Today I will be making a video of a female Foley catheter insertion. Sorry, it's not very clear. I'm doing it on my laptop and not my phone, but it's just easier that way. So the first thing that I'm going to do is I'm going to check the doctor's orders and gather my supplies. When I enter the patient's room, I'm going to wash my hands, introduce myself to the patient, screen for privacy, educate the patient on what the procedure I'm doing is, and raise the bed to a working height. Unfortunately, I'm doing this from a dining room table, so my working height, I had to sit down to be able to do this at a kind of working height. This is a sterile procedure, and I would need to ask if my patient has any allergies and any allergies to iodine or latex. Sometimes a kit can include those things for a catheter insertion, so you would just need to double check that. All right, so here is my kit. Just so you know, it says right here, Foley catheter tray. All right, so it's nice to use this as a little trash bag when you start to clean your patient so that you don't break the sterile field. So I'm just gonna put this right here, and I'm actually gonna push this a little bit more my way so that I can see. So I will start by pulling away, and towards me, and just make sure that you are using your 1-inch border when you're preparing this. I'm gonna scoot this over. So here are, I'm gonna use the claw technique. Can't see that. Use the claw technique. Here are my gloves. I'm gonna put these in front of me. This needs to go underneath my patient, shiny side down. Again, only touching the outer edges. And I can put that right here. All right, I am choosing not to use this. Okay, so my sterile gloves are here. I don't really have space to put my sterile gloves on, so I'm gonna come over here. Let me just show you that I'm putting my sterile gloves on. Again, this is not at working height, but just for the gist of it. All right, my thumb won't go on there. All right, there's one. Here's the other. Doesn't look separated whatsoever, so I can touch the inside of the glove with this hand. All right, and my sterile gloves are on. So I have to touch my computer to move it around so you can see, but at this point I would keep my hands like this. All right. So I am back over here. Now at this point I can touch anything in my box. I am going to start preparing what I'm using. So I would unwrap my catheter, make sure the tip doesn't touch anything, just because that needs to be the most sterile part of the procedure, considering that is what is going inside my patient. And then I have trash right here, so I would just toss this. What else? So this is the saline flush. I'm going to attach this to the catheter in advance. All right, and then here is my lube. All right, so I'm gonna squirt some lube into, can't see, into the corner of this bin so that I can use it with my catheter insertion. And then here are my cotton swabs. I'm gonna open these up and place them right beside me so that I can easily access them and clean my patient. All right, so once I touch my patient, I cannot untouch my patient because that hand is no longer sterile. So the very first thing that I am going to do is to touch my patient here and spread. I will take one cotton swab, clean the outside, and toss it in this trash. another cotton swab, clean the outside towards me, toss it in the trash, and then one more cotton swab and clean the inside and toss it in the trash. So at this point, my patient is ready for a catheter insertion. I have checked my balloon, make sure that my balloon inflates, because you don't want to do that after the catheter is already in your patient. You don't want to have to double catheterize them. So here is my catheter tip. I am now putting it in the lube, and you're going to spread. You may feel a little discomfort, ma'am. And I'm going to insert until I see flashback of urine, and then I will advance another 2 inches just so that I can make sure that it is in the bladder. So once my catheter is in the bladder, I can go ahead and inflate this balloon using my syringe, and I will hang the bag. This would be out of the way at this point. I will hang the bag on the bed below the patient so gravity can do its job. Other than that, I would make sure that my patient is comfortable. I would tape this to my patient's leg. I would date, time, initial, and put the catheter size on the bag, and then just monitor your patient while they have a catheter. A lot of infection precaution, because CAUTI is very common with these patients. But other than that, that is a female Foley catheter insertion. Thank you.